My name's Amanda Hayward and I am the Customer Success Manager that looks after practices in North Tyneside CCG, where your practice is based. And I'd just like to thank you for your time today to share your insight into how you've managed the flu campaign in previous years, and also discuss with you how you think the challenges that you'll face this year and how they differ. So, Christine, do you think it's more important than ever this year for patients to be given their flu vaccines?
I do. I think it's important every year, for obvious reasons. This year in particular, because the last thing the NHS needs is a bad flu season. I think people's immunity may be lower from lack of contact. I think flu numbers were down last year. But we're all back out again now, and I think if people start getting very sick from flu while COVID's still around, it will put a lot of pressure back on the NHS, so more important than ever, yes.
Yeah, and then I suppose then that it's not just the NHS, the hospitals and things, it's actually in the GP practices as well, isn't it?
Yeah.
So in previous years, what challenges have you faced in inviting patients for their flu vaccines, getting them to actually come in and have them?
The main challenge is probably the phone lines going absolutely crackers, but you're used to that. If we're lucky, we're a big practice, we have a few departments with a few phones, so you can manage it. Last minute coding changes, you suddenly you've run a flu full campaign and then they decide that actually the code's changed, so you have to then go be back, and that's always fun. Eligibility criteria changes, 1 minute carers are included, the next they're not. Or if you work in a dentist, you can have it. And then people jumping on that bandwagon, they suddenly realise that they are eligible. So can you code my record as I work here? But I think the main thing is obviously the traffic, the incoming phone traffic.
Yeah, and I suppose that'll be even more so now with limits on, patients that you can have in the practice at one time, with all the social distancing still that you're trying to adhere to.
It is. We did used to do it 1 minute appointments, and it was you'd have like bus loads drop off and people were in and out like that. But obviously now we have to factor in, if we're given the COVID booster as well, if it's Pfizer, they have to wait for 15 minutes afterwards. Where do they do that? And the one-way system, so we're not having people all over the waiting room. Trying to keep as safe as possible is a huge challenge.
Yeah, I can imagine. Have you given patients the option to decline the flu vaccine? When you send an invitation out to them, that they can reply back with a decline code. Is that something that you would use?
We do, yeah. We did that last year. I mean, last year was the first year that we invited using SMS and iPlay or texts. And even in the letter, we say, please get in touch and let us know if you're going to decline. It's important for a number of reasons. Mainly it's patient choice. It's absolutely up to them. But equally, again, to code the patient record as having been invited and declined for QoF targets. It's important to us financially that we have this information recorded. So more important than I think a patient realizes.
That's it. I suppose, if patients have got a quick, simple option to let you know that they don't want it, if that's their choice, at least that their medical records are up to date. So that's really good.
Yeah.
The cohort of eligible patients has expanded this year to include children up to 17 years of age. Now, do you think this will present any additional challenges for the practice?
The main one, I've thought about this, and you would think just adding an extra year, an extra age group, it wouldn't be so much, but the main thing is that they're school age, they're still in education. So we would have to do this in a time where they're available. So it could potentially be out of hours work for us.
Will they be having the vaccines in the practice, or do you know, or will they be done in the school setting?
I don't know. Okay. Sorry, I should have said if it was happening in primary care, then we obviously will have to cater for them outside of hours.
And I suppose that's the thing, nobody knows with a lot of the things with flu. That's half of the problem, isn't it? They're not knowing.
Yeah, there's a lot of unknowns at the moment, isn't there? So you have to kind of plan as if it's going to happen, and then if it doesn't, at least we've been prepared for it. So
that's it. Now, the flu enhanced service specification now requires you to include patient ethnicity data to be collected. How are you planning on achieving this? Is it something you've already started, or?
It was, this is a hard one, because ideal world for us, it would be great to be able to send out a batch, you know, could you let us know your ethnic origin? But obviously there's no way, there's so many options and there's no way of getting a direct answer back easily. And so what we did last year is we used the flu campaign as the way of doing it. So when people were ringing in to book their appointments, we were asking them then if we didn't have that. And when people came in for their appointments, the admin staff were aware to check if we had it. And we just plodded through it that way, and we plan on doing the same this year. But the flu campaign is a good time to actually get that information, because you're getting a lot of people.
Yeah, I suppose there's a lot of people coming into the practice that you wouldn't usually see, and it's a good chance to get that. No, that's really good. The JVC has advised there shouldn't be a problem with vaccination deliveries in time for the start of your flu campaign. Is that your understanding too?
That is our understanding too. And I would say every year there's always a risk of delaying stock being delivered, flu vaccines going out of stock. And obviously we do have to predict, and it's impossible to know how many we need to order, how many we need, how many people, especially this year with pharmacies being quite well established now, after delivering the COVID vaccine. Pharmacies are well established for delivering this service as well. And so we do have to give a rough guess of how many we think we're going to be vaccinating, and every year we always have the risk of they may be delayed. So it's a bit of a gamble when you set your flu clinic up and you've got to hope that your delivery arrives in time. But yes, my understanding is that there shouldn't be a delay this year.
Oh, good. At least that'll be something. Lastly, how are you planning on using the MyGP Connect system that you've got in your practice for your flu season?
Well, we actually started it yesterday. And at the minute I've set up, so we're sending out 200 SMS messages a day. We've got a couple of clinics set up ready. We're trying to target those who aren't necessarily in stage 1 for the booster. If that happens, we're having to we don't know if we're going to be delivering both vaccines at the same time, but we've decided to get this, hit the ground running with flus anyway. And so we've targeted those who are less likely to get the COVID booster, so at least they've had the flu. I've set up a lot of messages, 200 a day at the minute, to go out over the course of the week. And I would like to. I need a refresher on how patients can book their own appointments. I know they can do it on the app. I know, and at the minute we haven't been doing that because we haven't been face to face. But the flu campaign is different. It has to be face to face, and at the minute we're running it on slot type, so over 65 vaccine, under 65 vaccine. I'm not sure how that would work. So it's something we want to do and will do. I haven't done at the minute, but basically we use the SMS for everybody who is eligible and who has a mobile number, and it's absolute lifesaver, to be fair. It's a game changer.
Yeah, definitely. Brilliant. That's really good to hear. We do offer refresher training, the flu events, the planning. We are going to include the functionality that you're looking for, so that patients can book those appointments directly from the invite. And hopefully that will reduce the incoming calls into the practice.
It's definitely something we would want to do. I think, like I say, I'm out of touch with it because we haven't been doing it. But I think if we'd been doing it for the last year, where they could book in to see a GP, we'd be very familiar with it. But it would be something that I think I would have to have a quick return on.
No problem. Well, thank you so much for your time today, Christine. You've given us a real insight to how things are in your practice and how you perceive things today. Thank you.
Thank you for having me.